Good afternoon. It's April 6th, and I'm with Dr. Teresa Frankovich, who's going to answer the following questions. Can we get an update on the 3 people who were hospitalized?
Well, we did report that we've had 3 cases to date who have required hospitalization, but we're not able to comment on their particular clinical picture.
Okay. Have there been any COVID-19 related fatalities in the county?
No, not that we're aware of at this time.
What is the coordination with tribal entities, and how are tribal members' healthcare needs being met during this pandemic?
Well, just like all of us, I think they're collaboratively planning both within the tribe and also reaching out. So we're having conversations with tribal entities to look at issues around contact investigation, for instance. Historically, we've been assisting in those in other instances of communicable disease, either outbreaks or cases. And so working with those individuals to try and make the process as smooth as possible and provide support where we can. And we're a resource, certainly.
What is the reporting process for a sovereign nation?
Well, internally for their own process, obviously that is their issue, and I think it would be an excellent question to ask them what their intents are with that. From our standpoint, if we have tribal members who are part of our positive cases, we will report them as we do all of our cases in the same fashion. And then obviously it's within the purview of the tribal entities to make decisions about how they're going to present information on their tribal members.
Okay, are there any positive cases so far reported by Humboldt County that were from tribal lands?
Again, I defer to them.
Would you consider picking up takeout from a restaurant to be an essential outing for people with the option of preparing food at home?
So, I think what people need to bear in mind is that what is the intent of shelter in place? The intent of shelter in place is to create as much distancing as possible and to limit the number of times you're outside your home. Now, obviously, people need to leave their home to get groceries, to cook, and do those sorts of things. And so, again, I think people trying to space those trips to plan in advance so that they don't need to have more trips than necessary, which only increases their exposure. And the community exposure is a really good strategy. I think in terms of takeout food, I don't know everyone's individual situation in their home. I would certainly encourage people to plan, shop, and prepare meals at home as much as possible during this. But I appreciate the ability of, for instance, restaurant entities providing food for people who are out working or for whom that may not be an option at all times of the day.
The modified shelter-in-place order directs people aged 65 and over to stay in their residence to the extent possible, except as necessary to seek medical care. The 3 members of the Humboldt County Board of Supervisors who attended this morning's meeting in person are over that age. Should they be staying home and participating in meetings remotely, both to minimize personal risk and model appropriate behavior for the community?
I think certainly they can talk to the Board of Supervisors about their personal decisions they're making on this front. I think that certainly we have asked seniors and people who are at risk because of medical conditions to try and remain home. I certainly recognize that there are essential workers, many among our workforce, who are working even though they are in higher risk categories because they're essential to ongoing services that we provide. And so we recognize that they are making that choice. And of course, we're all working on social distancing and trying to maintain safety for everybody in the workplace as much as we can.
Thank you. If residents are showing symptoms or feeling sick, at what point should they seek medical attention?
I think, again, we've sort of messaged to people that if they have very mild symptoms, they really should be monitoring themselves at home. And again, using the sort of directive we have put out, which is if you have fever, if you have an illness, you should be staying home until you are 3 days without fever, without using fever medicine, your symptoms are clearly improving, and that it has been at least 7 days since the onset of your symptoms. So everyone can use those guidelines. They should contact their healthcare provider if they're concerned that their symptoms are more severe and they actually feel they need medical evaluation, but not simply for diagnosis.
Are headaches, dizziness, loss of smell or taste, are any of these symptoms of the virus, and do they warrant getting tested?
Well, just like cough, fever, other respiratory symptoms, shortness of breath. Some of these symptoms can be seen with COVID as well. But again, in individuals who have mild symptoms, our recommendations would still be the same, typically to follow the guidance we just talked about. But also, if they are a high-risk group individual, if they have concerns that they are at more risk for serious complications of COVID, I certainly encourage people to talk to their provider about what is recommended in their particular case.
Thank you. The initial shelter-in-place order was set to end this week. Although the future remains unclear, based on models in other countries, when do we think this order might expire and the threat of infection will dissipate?
Again, it would be really good to know that for sure. And right now, all I can say is not yet. We know that we are still watching events unfold in California at large with increasing case counts in many areas of the state, significant increases. We are also seeing increasing case counts right now. This is our opportunity to slow transmission and try and minimize how quickly we accumulate cases locally to least impact our healthcare system. So now is not the time. I can't say when that time's going to be, but we'll be watching this continually and understanding that we don't want people to be in this position any longer than we have to be. It isn't easy for anyone, including our staff and such too. So we understand that and we want to use it as long as it's a useful tool and no longer.
The last few COVID-19 case reports from public health have not included a tally of active cases. Is this county still keeping track of that? And if so, what are the criteria for moving a case from active to recovered or inactive?
Well, one thing I would mention is that when I'm looking at data from around the state and other counties and other places, reporting is certainly all over the board on this. But one thing that strikes me is that if you look at areas with perhaps hundreds of cases, you might see that recovered category is very small. And I think it's because it's a very hard number to keep up to date and accurate. That instance of when individuals are coming out of isolation, when they are symptomatically improved, when we call them completely recovered, is a little bit vague. And so what we're, I think, looking for is something that might be more meaningful for people to report on, that we can actually keep updated in a really accurate and ongoing way so that we're giving valuable information. So we're working on that internally because I think the categories as they are not all that helpful.
On Friday, Governor Newsom announced that the state has secured more than 7,000 hotel rooms across the state to house people experiencing homelessness who are most threatened by COVID-19. What is the county doing to identify at-risk or potentially infected homeless people in our community, and what steps are being taken to isolate and house them?
So it's a really important question, and we are really working alongside the CDPH guidance on this as well as CDC recommendations. So we are actively working with partners to screen homeless individuals in more gathering where people get services. We have developed algorithms to help move those individuals towards testing if they're symptomatic, and then to provide shelter while we're waiting test results. And if someone is positive, to provide ongoing shelter until they are no longer infectious and can return to their activities in the community. During that process, we're helping to provide assistance they need, for instance, in terms of food. So that actually is in place right now and is working really well. The county is also looking at plans and implementing some additional measures to protect homeless individuals, particularly in high-risk groups, so older individuals, individuals with other health conditions, and provide some of that assistance in terms of housing and monitoring as well. But the broader picture right now, too, is just helping the population as a whole. So we're working on information messaging to the population, and I'm sure everyone's been noticing sort of hand washing stations and porta potties and those kinds of things meant to help facilitate care for people. So it's a work in progress, but I think we have a lot of key pieces already in place. We'll be constantly expanding that.
What is public health planning to do differently in regards to testing following the governor's new request to, quote, exponentially increase the amount of COVID-19 testing?
Well, again, as we've been saying all along, we would ideally love to have infinite testing capacity and certainly even more than we have at present, although I do want to point out again that we've been doing remarkably well in Humboldt in terms of our rate of testing for a community of our size. In fact, we've surpassed 1,000 tests for local community members, which is, I think, really impressive from the standpoint that we have a very well-equipped but very small public health laboratory. And so it's not as simple as throwing more bodies into a laboratory space. Our laboratory space is already quite full in terms of capacity to put people in there. What we need to be more, to increase testing on site is added technology. And so we do have some equipment on hand that we can do some increased testing rates that require less microbiologist time and has higher throughput with runs. And we are in queue, as many entities are, to get some of the supplies that would allow us to move forward on that front. So that's how we're addressing that internally. Obviously, commercial labs are an important resource, and as they get better and better operationally, that will help. And of course, everyone's looking at new testing technology coming along and how that might fit into a picture of expanding testing within a community. Right now, I'm not aware of the state, for instance, sending resources locally in terms of mobile testing stations, that type of thing, to assist. So we're really working on building capacity that we can internally and then through commercial and other venues.
And I think you've already addressed this last question in your answer, but are we planning to hire extra help to perform more testing?
Right. So again, we have a very high level lab with very intensive restrictions on working in that setting. And I would imagine that at this point in time, available microbiologists, for instance, who meet fit the bill, are in rather short supply in this country. And you know, what I'm saying is that because of our space and restrictions on what we can work with, we're really not looking for additional bodies as much at this time as really refining and improving our testing methodology so that we can increase productivity in that way. I think that's what makes sense. Public health labs in general were not designed to be high throughput labs. They're a resource. Commercial labs are designed to have that very high capacity and high put through.
Excellent. Thank you so much.
Thank you.